Hello, mindful humans. This is the Mindful Minimalist Show, where we discuss minimalism and mental health. If you'd like more information and inspiration on these topics and more, hit the subscribe button and the notification bell. This episode is all about therapy. Licensed therapist Caroline Adams is here for a Q&A, and it's going to be a little bit of a non-traditional interview. Also, I want to let you guys know I will have a discount code for you at the end of the video from Nicole Lauren Boutique, so hang with me till then. Why don't you go ahead, Caroline, and introduce yourself. Tell us a little bit about yourself and your work.
Hi, my name is Caroline Adams. I'm a licensed professional counselor associate. I'm a therapist in private practice in Charleston, South Carolina, and virtually. So the main type of clients that I work with are really anyone navigating women's issues, really all walks of the lifespan in womanhood. A little bit about my background. So I have worked in mental health for about 5 or 6 years, and my personal experience with postpartum depression and anxiety really pushed me to really shift my focus in my practice and specialize in perinatal mood and anxiety disorders.
I think that's awesome that there is someone that we can go to that has that specialty. My next question for you is, who should go to therapy?
Anyone. And I love this question, and I love to talk to clients about, don't get hung up on, is this problem big enough? Is this issue severe enough? Do I have to have a diagnosis? Absolutely not. Really, who's a good fit for therapy? Anyone who needs extra support. There doesn't have to be an inkling that you meet criteria for a diagnosis. You don't have to have had a traumatic event or really anything like that. If you are just sort of struggling, you want to work on some personal growth, therapy's for you. If you're someone who's experienced, trauma in their life, birth trauma, you're adjusting to, a breakup or a new relationship, all of that, you're all worthy, for therapy and for treatment. So there is no sort of checklist for criteria that you have to meet or, problems you have to be worthy of therapy by any means.
I really like how you're saying that you don't have to have a mental illness or have some type of disorder to go see a therapist. And I think that is a misconception that a lot of people have, is that therapy is for crazy people. And it's really so much more than that. So I want you now to tell me, what does a typical therapy session or therapy program look like?
We'd schedule that first session, and the first session is really very much evaluative. It helps us get a better understanding of sort of what your needs are, what what you really need support in, and we'll talk about what your wishes are from our work together. So what would you like to see happen? Like, how will you know that we're ready to end our sessions and our work together? So very evaluative sort of planning. It really is more just, what would you like to see in yourself? Like, what changes would you like to, less, I want to be 5 pounds lighter, something like that, but more, more intentional or purposeful, or maybe it's a more, immediate sort of concern that you need support with. From there, I really like to see clients weekly to start, just to, find our footing, help, get you back to baseline in order to sort of get the most out of our work together. Really seeing each other weekly to sort of make some headway. And then from there, we could certainly, revisit our goals, look back at any assessment scales that we may have done, for anxiety, depression, PTSD, anything like that, and see where there's changes. If you are working with someone who prescribes as well, sort of a collaborative approach. That's what a typical session sort of process looks like. Is it my job to sort of like come into a session, my job, me as the client, to show up in a session with talking points or things to talk about? Not necessarily. But for the most part, if you have something on your heart or something that's happened that week, that takes priority. And I'm sure there's some strategies that can be worked in. So By no means do you have to show up with, talking points, because there's always things to explore and talk about. But it is helpful to sort of, maybe before the session, get an idea about maybe things that have, been heavy for you this week, or things that you might need help with.
Now, will the therapist tell anyone what I say? This is a huge concern for a lot of people because it comes to privacy when it comes to their personal issues. So I would love to hear your response on this.
Okay, so the main sort of blurb in my informed consent paperwork talks about confidentiality. And if you've ever worked with a therapist, psychologist, social worker, any of that, there is always a confidentiality piece. So anything that we discuss is private and stays between us. And there's a couple exceptions to that. So if there's any reason, to believe that you or someone else are in danger, fear of taking your own life or the life of others, or harming someone else, that would be when someone else gets involved. I've never had that happen in my practice. That isn't to say that it won't.
Quickly before we move on the same note as what you just talked about, will my children get taken away if I have depression or bad thoughts? This kind of goes hand in hand with that, with, are you going to tell someone? Are you going to report me? Will you tell the police? Will I be taken to jail? These are a lot of fears that especially new moms have in the postpartum period. I know you're really familiar with that.
I love this question. I think this is why it's important to speak to someone who specializes in depression and sort of intrusive thoughts. So majority of therapists, psychologists, psychiatrists that you see have a very good working understanding of depression and sort of the various thoughts that come with that. That's not to say there may be some providers who don't have a great understanding of sort of risk factors around suicidal thoughts, things like that. So the short answer is no. I have the training and sort of understanding to be able to listen and understand about suicidal thoughts, intrusive thoughts, especially around postpartum women, and know the difference between, like I mentioned before, an imminent threat, something that holds intention, versus these are thoughts I'm having and I'm horrified. So that's the main difference. So speaking with a provider that has the training and understands the difference in that, and isn't sort of trigger happy with panicking around those sorts of conversations around scary thoughts, depression, suicidal thoughts, things like that, and having a good understanding and being comfortable with being able to sort of dig and get a better understanding of, okay, what are the buffers in your life? Like, what are the things that are worth living for? Assessing for that, creating a suicide prevention plan, setting that person up to heal, and to, incorporate any other providers that are, working with that client, psychiatrists, anyone that's doing medication management, and having a clear understanding of the function.
So you're saying, it's going to be confidential, children won't be taken away, but why should we trust that? Why should we believe you or any other therapist?
You should trust a therapist because, for the most part, they are people who are in this profession because they have a heart for helping. They lead with empathy, they care, they genuinely like connecting with other people, helping people change their lives, and grow. Like I talked about before this, there's that confidentiality piece. And I know, I don't take it lightly that someone sits on my couch and is vulnerable and shares their pain and their heart. I mean, that's heavy. And, for the most part, I think therapists really are humbled by that. I think that they don't take it lightly that someone trusts them, reaches out to them in pain, in a moment of weakness, and trusts them to help. And so for the most part, trusting, I think my advice would be connect with someone and just ask questions. You know, ask, why should I trust you? You know, get a feel for who they are as a therapist and as a person, you know, so get a feel for their heart and if you feel like you connect with them.
That's so comforting to know, because this is something that I personally dealt with right after I had my son and my PTSD was triggered. Right after that, I started going into depression, and it was just a scary time for me because I didn't want to tell anyone. I thought they were going to take my kid away. And I finally started seeing a therapist and found out that that wasn't really the case. So thank you for breaking that down for us. This next question is one that I personally have a friend who I know is struggling with this issue. And the question is, what should I do if I don't like my therapist? Sometimes people just don't click with the therapist, or it's just awkward, or they don't feel like the therapist is being very professional. So what would you do?
So I've talked a couple times about transparency being so important about that relationship. You know, this is an investment in yourself, and a lot of times expensive. And so it's in your best interest and the therapist to make that known. If you don't feel like you like them, or, you know, maybe a better way to say that might be you don't think they're a good fit or you're not connecting, share that with them. You know, I think you know, we use the term ghosting. You know, if you just sort of like disappear or stop showing up to appointments, things like that, that often comes with a level of guilt around that. So I think just transparency, you know, shoot them an email, let them know in session, have a conversation about it. Just that, you know, maybe let them know some things that you've gotten from your work together, but this is what you'd like to see. And if there's room for growth and improvement, and you think that therapist is able to sort of show up in that way, and sort of pivot a little bit with your work together, great. If not, you know, just very candidly let them know that you don't think you're a good fit.
I completely agree with you that it is just best to tell the therapist, you know what, this isn't working for me, and just start looking for a new way. My final question for you, and it's one that I think is kind of a tough one, is what should I do if I don't have insurance or I can't even afford therapy at all? And I know this is so hard because as therapists, I'm sure you just want to help everyone, but it's also your profession, and that has to be a tough place to be in. So what is your recommendation for people who are in this situation?
This weighs really heavy on me sometimes. So I am a self-pay only practice, meaning that I'm an out-of-network provider, so I don't accept insurance. You know, some clients can, you know, submit a super bill themselves for potential reimbursement, but I think that mental health care should be accessible to everyone. I firmly believe that. And, you know, it's hard because I am not financially or personally capable of accepting insurance. And so there's a place for you. And it shouldn't be like this boutique sort of only people with money, you know, have access to it. And I firmly believe that. So if you're someone who doesn't have insurance or the means to see a self-pay therapist, or someone who accepts insurance but not yours, my recommendation is to search for providers in your area. So Psychology Today has a nice option where you can choose different specialties and things like that in their search criteria, and you can choose you know, someone who is self-pay or doing sliding scale options, or pro bono even. A lot of times interns and people who are just getting started will offer sessions at a discounted price. I know some nonprofits like Postpartum Support Charleston have grant programs where they actually will pay based on need for clients to be seen by therapists, you know, that's grant funded. So do a little bit of research, you know, into nonprofits in your area and see if they have any grant funded options. Also, some of the bigger practices, so like a lot of hospital psychiatry units will have options for people without insurance, and support groups that are free. There's, like I mentioned, internship programs where they're looking for clients or students to, get that practice. So that's a really nice option to explore. Let me also just mention, if you are really struggling, having suicidal thoughts, thoughts of harming you or someone else, you're feeling sort of out of control and really need help, go to your local ER. I know it's sort of scary in COVID times. An alternative would be to call the hotline, which I'll include and send over to you, the suicide prevention hotline. And there's a lot of really great support people who are able to sort of chat with you on the phone and help support you and get you the resources that you need. And I'll also be able to link my information about my practice. If you're interested in telehealth and are in South Carolina, I would love to hear from you. If you have any other questions, don't hesitate to reach out.
Thank you so much for all of those options that you presented. Some of those I didn't even think about or didn't even realize were possibilities. So I really appreciate you giving those. And I want to say thank you overall for participating in this interview Q&A session. You were so helpful to us. You were so insightful. And it's wonderful to have a professional here speaking with us today. So thank you again so much. And like I mentioned, I do have a discount code for you for an adorable mental health t-shirt that you will love. And it is from Nicole Lauren Boutique. And I will be sure to have that code and link below for you guys. Go check it out. I get zero benefit from this, but it's simply something that I put out there for you all. And I'm just thankful that this business is willing to work with us to help give you guys a great discount on this great item. So anyhow, I will catch you guys for the next episode. Be sure to like, comment, subscribe. Bye.